to talk to us today. So we have with us the new Public Health Commissioner, Jennifer Wenzel, and we have Dr. Doan, who is a frequent visitor for us. So if the two of you would like to come up to the table and sit where there are empty chairs, please join us. And we can talk a little bit about, we're looking for some guidance and direction related to the science with masks now and the current numbers of COVID cases, the Omicron cases, whatever you can let us know so that we can make an informed decision about what the Dayton Public Schools should be doing. So thank you for being here tonight, and thank you for being here on such short notice.
Thank you for the invitation. Cases in our community continue to decline, which is a very positive considering where we were 6-8 weeks ago. So we're very confident that the numbers are on a decline, and it's a good effort representative of the vaccinations that we've done in the community and other mechanisms that we've used to reduce the spread of illness. And at the end of February, the CDC released a new community level framework that now puts our community at one of 3 different risk levels for the spread of COVID-19. Currently, our community is at a low level, which is the lowest level according to the CDC's guidance. And that's based on the number of cases and also hospital data and inpatient hospital COVID patients also. So there's different mechanisms that are being used to measure COVID in the community and recommend a level based on those criteria.
Dr. Doan, would you like to add anything?
Sure. I think, the last time, just pull it towards you. The button? Oh, okay. The last time I was here, the discussion was whether masks made sense, and they did. And there was an article that just came out this week talking about how masks were effective in school settings. And that, those studies are necessarily older by the time that they get done and all. At this point, the consensus really is that the masks don't add anything significant to protecting people particularly. So that there's not, the rate of infection is so low. People are doing so relatively well with this infection, with asymptomatic infections and very mild symptoms in many cases, especially younger people, that the sense is just that, and this is why the CDC made the recommendations, that masks are really not a significant factor at this point in trying to control the spread. We also know that schools, where you have everybody sitting kind of side by side in the typical setup, is not a particularly active atmosphere for spreading anyway. This is much different than preschools and daycares, where we've continued to see outbreaks occurring. But with K through 12 students, it seems like we're kind of past the worst of it, and it may be time to get things back towards normal.
Appreciate that. Do we have any questions from the board while we have our guests here? Dr. Goodwin.
So you said, first, at Public Health, what's you guys' mask policy? These guys supposed to do that.
Thank you. I didn't want to be done.
I thought people did that for us, But what's your policy at Public Health right now?
Do you want me to answer, or do you want
I
to?
can answer. Currently, our policy is masks aren't required unless you're in a healthcare setting giving patient care.
Okay, and you said that, you just said preschoolers, you see that the spread is different than K through 12, you said, correct?
Well, there's still, if you look at group settings, in the last 3 weeks, I think we've had 1 nursing home, and the others have all been little kids in preschools and daycares.
So we have preschools that are in our schools, so knowing that that's there, that is still, you're still saying it holds true that the spreaders with younger kids is at a higher rate with preschoolers?
It seems like they're still passing it around, and it's getting picked up there.
So my question to you then more so is knowing, well, not knowing, we have, our preschoolers are preschool through 6. And knowing that those preschoolers still are passing it around at a higher rate, what would your recommendation be, knowing that they're not separate like a daycare?
They, people have split this different ways, and masks can help. The problem, though, with the littler kids is that, they're not respectful of each other's space always. They don't have the social distancing and the rest of that, and so I think it's just going to be very difficult. On the other hand, as we said, they don't have too much troubles with it, and at what point do we just say, kids are going to get sick, they're going to get the sniffles, they're going to get things. We would like, of course, not to have people take the infection home and then infect a family, which we've had cases of that from the preschool. And, it's going to be important if there's somebody that's at risk of more severe disease that the child's going to be in contact with. That would be a consideration for that household to how they'd want to handle it. So that I think, most of the preschools are sort of tending, because they're seeing troubles, to try and keep the kids in masks to some extent, trying to stay up with the hygiene and the cleaning and the rest of it as much as they can. But it's a very difficult environment.
Okay, thank you. I had a question. It's more so for you, Dr. Lally, on this one. Have you, and anybody on the board, feel free to jump in, because I've only received, I think, about 3 people who have actually talked to me about masks outside of this group of individuals in this setting right now. My question more so is, have you gotten a pulse from our staff leaders on where they are with our current mask mandate and knowing that the CDC has changed its guideline?
Yesterday at the superintendent's advisory, one of the items for me to answer was, has there been any consideration for removing the mask mandate and making it mask optional? So I told them that we actually had public health coming tonight. They are hoping that we get back to normal I asked the DEA president also to kind of do a sampling across the district, and there are some people that are concerned, but the majority of people are hoping to get back to normal.
That's the teacher side. What about in our transportation, our custodians, our food service? What's an overall staff is what I'm looking
I don't have anything from them, anecdotal or otherwise, other than just a conversation with their main leaders who are not here day to day. So I really don't have anything that would be accurate to tell you about that.
Okay, so my ask would be if you could reach out and try to see, because I kind of would like to hear with the people who are in the building, what their thoughts are on it overall as well. That's all I had.
Vice President, did you have, or?
Thank you, Madam Vice President. Thank you, Mr. President. A few questions for me is, I know that you guys represent public health for Montgomery County. Is there a different data analysis for the city of Dayton as it relates to COVID cases versus the county? Is there a different data point where we're seeing increases or decreases in Dayton proper, or is just your data strictly county related?
I think the data that we have right now is strictly county related, but we could look a little bit deeper at our zip codes. We could look at zip codes possibly.
Okay, and that would be great. Second question is, what is the vaccination rate for Dayton proper versus the vaccination rate for the county? Those are a couple questions that I would absolutely love answers to.
We can look at the zip code data for Dayton. For the county as a whole, it's 59% started.
The county as a whole is 59%?
County as a whole is 59%.
And what is the immunity percentage? Is it like 70%?
It depends on whether you're talking about prevention of infection, or if you're talking about prevention of hospitalization, or you're talking about death. And the vaccination rates, you have to throw into that the fact that just having come through this huge swell of cases, a lot of people are immune because they just had it. And so we have no idea what that number is, but it's a substantial number of people. And so the real kind of protection for the community is going to be a combination of those two. The other thing that's kind of odd, I think, is that as they keep looking at immunity after infection, it seems like the more recent viruses give better immunity. The Delta and the Omicron, they seem to be able to find more long-lasting immunity than they did from the original strains. So I think that's part of the thinking as well that went into the CDC recommendations. It's not just the vaccination rates, but also, paradoxically, places that had low vaccination rates had a lot of people that just got sick who are relatively protected now. So,
Okay, thank you so much. Thank you, Mr. President.
No problem, Vice President.
Thank you, Mr. President. So, I mean, I'll be frank, I think I'm landing on the more cautious side of things, and I just wanted to let you guys all know. But I think there are some really important questions to discuss in this conversation. The first is if we did change the mandate to a strong recommendation, watching and looking ahead to new variants. First of all, are there new variants that are popping up already? We just got off the Omicron. Is there anything that is on the horizon that is, if it pops up somewhere, it's gonna get here very, very quickly. That's my first, I'll say all these questions all at once because they are put in context with each other. And what is the curve behind when the testing curve kind of is behind the curve of when infections are actually hitting people. We don't see it until there's a little bit of a delayed reaction from when communities are getting it and then when they are able to get access to tests, and then we see the rise in cases. And at what point would we want to put the mandate back up? What would be the triggers that we could set out if we were to go this way to say, at this point, we're seeing something pop back up, and in order to prevent our students, staff, teachers from getting sick, this is the very first point when we say, okay, we've got to get serious again, we've got to mask back up again.
So I can talk about when we go back to masking. I think it would be important to take into consideration CDC's framework. It's laid out with low, medium, and high. Where we're currently at, low is not recommended indoors unless you're susceptible to illness, you have other health conditions. And then masking might be recommended at medium level and is definitely recommended at a high level. So by paying attention to those levels and that framework, that would give us an indication of when to go back to masking. As far as variants, I don't believe there's anything on the radar right now that would be of concern.
There's nothing certainly in the United States. Radio News and others talked about Omicron B, there's some hype about that, but nothing's come of that. We're still 99% Omicron in a few cases that are still coming out. If you look around the world, there's nothing. Oh. Should I start over? So there was concern about Omicron B, and it got some play in the press, but you don't hear about it now because nothing happened with it. We're still 99% or better Omicron in the United States, and so it's not being supplanted by anything else. We've got many fewer cases. They're still all Omicron. As far as things in other parts of the world, there are different variants out there, but none of them are showing a propensity for spreading very easily. And so it's not, there's nothing on the horizon. If we think about the last surges that we had, it would go up, and as it was coming down, something else would start up, So it was sort of like every time we got something taken care of, there was something else knocking at the door, This time there's nothing knocking at the door, and there isn't really anything even on the horizon. So, the other question was the testing curve. We've never been in this position before. We have so many tests out there, and you can order more free from the federal government, evidently, starting next week, so that we don't know. I think that the testing, if things kind of go on the way that they are now, testing is going to get more incorporated into regular routine medical care. is going to become more available, I would hope. And at this point, unlike 4 weeks ago, you can find tests pretty much anywhere.
Is the testing site at Dayton Children's at the Springboro location still open, the drive-up testing for the PCR?
Yes, it's still open.
Is it expected, do you know what the long-term plans are for that? Because I think the rapid testing is good. You know, I ordered my tests. They took a lot longer than I expected them to come, and I saw today that we could order more. But, you know, I only got 4 tests for a family of 5, and you're supposed to use 2 tests for 1 person. You know, it's not enough, and it's hard to find the rapid tests. When you were here before, you talked about the PCR tests being more accurate, and those are the ones that we depend on in terms of going back to school and going back to employment. So do you know what the long-term plans are for the drive-through PCR testing location at Dayton Children's in Springboro?
I do not know that. I do know that they're constantly evaluating what the testing looks like, as well as our other testing locations throughout the county. So I don't know what their long-term plans are at this point.
But you are exactly right. Whatever their scalability is, they'll always be behind. So they won't be able to scale up fast enough to when people want the tests, and they won't cut it back fast enough when it's no longer necessary.
What about the recommendations from the CDC in terms of when there is a diagnosis for a student or staff or an exposure? Has that changed at all? That is still the same?
Yeah, the mask to stay, test to play is still in effect for our state, so that is unchanged for us.
Thank you.
Mr. Sampson?
Thank you, Mr. President. One more ask for me is there data that shows, I know there's national data, nationwide data, is there data points that you could give us for COVID-related cases as it relates to urban environments versus the national data? I'm really interested to see what the data looks like in urban communities versus, you know, big picture, if that's possible. Thank you, Mr. President.
No problem. Any other questions? I'll go to Board Member Witt Gagne, then Dr. Goodwin.
Thank you, President Smith. My question would be for you, Superintendent, and that would be that if we do, go to the mask optional type model and we have any of our teaching staff or any of our staff that feels more vulnerable, would they have any space or autonomy to require like a mask in their classroom or a certain thing? I mean, how much flexibility within that optional, lens do we have, or could we enforce?
I don't think that any of that's been discussed, but I would say to you that the mask is to protect the person that's wearing it. So that person would be protected, and if they stand back, like most of our teachers have been standing back since we came back full-time, face-to-face, they stand back away from their students, and if they get close, then, everybody has a mask on. So we haven't talked about any of that, but I'm not certain we can control that, to be real
Right.
honest with you.
Is it, and correct me if I'm wrong, but the masks were intended initially to prevent spread from me to you, not you. Does that make sense?
But
You say,
But it protects me also, because
Sure.
you're not,
yeah,
I'm not breathing.
right.
That's
right,
what I
right,
mean by
yeah.
that.
So it's
Yeah.
a reciprocal protection in a
Correct.
way, so, yes, thank you.
And me staying away from you without a mask on is my other protection. And that's what I mean by the teachers have stood back from students, and those teachers that are comfortable get close to students. Yeah. Those teachers that get comfortable get close to students, that kind of thing. But for the most part, people are away from each other in the classroom at this point. I'll be real honest with you. The majority of our students are over mask, and we were out at a building today, and the kids they all complied and had their mask on, but you would see them pulling them down, like we often do, because we get so warm. But anything that we can do to relieve that a little bit, I think, would be positive going into the spring months when it's going to be warm and warmer.
Dr. Goodwin?
So I'd like to remind you, I've only been on the board since March. My question is on making sure that the schools stay open now. So I know, my first ask is, compared to our surrounding schools, and this is for superintendent, our surrounding school, how often have we closed since we've had our mask mandate?
We haven't closed at all, but we've had high numbers that we've tracked every week. After the winter holiday, we had a large number of absences of both students and teachers. Right now, we have, last week, for the last 2 weeks, we've had less than 5 people, less than 5 teachers, and less than 5 students who've had, have contracted the disease. Last week, it was 2 staff members, I believe, and 4 students. And that's kind of the number we've been running for mid-February through today. We had a surge in January where we would see numbers of, 25 and 35 and that sort of thing, but that slowly went away just like it did in the rest of the country. And now we're down to, like I said, 4 and 2.
And a follow-up question, because I know spring break is coming up. Do we expect to see a surge after spring break? Or do you think we're going to stay flat at that 5-to-2 ratio right there? Or do we even know what that's going to look like coming back?
I don't have a guess on that, but I do know that our students are, if they're together over spring break, like in the neighborhoods together, they're together like that now. So if they wear a mask now, I'm sure they would wear a mask being together, but I don't think most of them, when they gather together in each other's homes or when they play ball together and stuff, that they're wearing masks. So like you said, for the older kids, the K-12 kids, I don't expect a surge, but I don't know. I can't answer that.
And my final question, if we did go to an optional mask policy and we did see a surge, could our staffing handle, like, if we had individuals out, how would that impact us? Do we have, like, people on reserve that could sub for them, or?
We would handle it the same way that we had staff out when we did have masks and we did have a surge, and we cover classes and pay people. That was one of the issues that we had been talking about and working through, was that teachers cover on their planned time, teachers cover other classes, they bring classes together, that sort of thing. We would do the same thing that we did when we had the really, really large surge.
Okay, thank you.
Any other questions? Ms. Reiner?
Thank you, Mr. President. This is for the superintendent. So has there been any consideration towards looking at our policy in regards to bullying for people who continue masking? And I ask this because I was on the Ohio School Board Association Urban Network call last week, and I asked board members across the state, it opened up for questions, and I asked people what mask policies were in their districts. I looked at the Department of Ed, and there was a breakdown as to which districts were mask recommended, which districts were mask mandated at that point. And there were still like 100-ish districts that were still mandating masks, and like 470 some that were recommended, and then a number that they had no mask policy. And it was interesting to see that breakdown, but a number of the districts, the board members from those districts said that they were, looking at the same sort of thing that we're doing right now, but also making sure that they were looking at the policies to keep students who still feel very, very, very vulnerable, and making sure that they are protected, and that the language is strong about bullying, and bullying specifically protecting students who choose to continue wearing a mask. I think our community is one that has always valued public health, and we were early to mask, and we were one of the first districts to put the mandate up before the school year started. And I think that's really good. I would like to think that this wouldn't be an option in our district, but I want to make sure that we're covering all of our bases and making sure that we are having that part of the conversation as well.
We haven't talked about a policy for that, but we have policy committee next week, and we can certainly talk about that. Because of the variety of cultures that we have in this district, there are some different things that cultures do here in the district. For example, we have students who have face coverings all the time and have had before masking. we don't seem to have bullying issues with that at all. There's a respect that's within the district for that. I don't know that there would be bullying associated with wearing a COVID mask, but we can certainly make sure that we have some control over the fact that, you know, it's not tolerated if I choose to wear my mask and you choose not to, and you're trying to bully me in any way. But we've been, as a district, pretty respectful of different, you know, different communities that wear different clothing than what we wear.
Yes,
what's
I
up,
agree.
right.
I just think it's a good thing to have a discussion about to make sure that
We can put
we're.
that on the policy agenda next week.
Yes, thank you.
Any other questions from members of the board? Oh, Mr. Doan.
I just want to mention real quick that one of the sticky points for some schools has been choir. What do you do with choir practice, for example? And different schools and different churches have split this different ways. Some people, you know, some churches will use masks for choir practice, but not for the service when the choir sings, for instance. I would say that the CDC and these guidelines does not make any distinction between one activity versus another. They just say, you know, low situation, you don't need to wear masks. They're not going to be a significant factor in whether the virus is spread or not at the low levels. But I know that's something that comes up, and you may find that people are concerned when you start talking about band or choral singing.
Appreciate that, Doc. Dr. Lally, on my end, I do want to bring up some of the things that we want to make sure that we're looking at. Like Board Member Sampson said, looking at cases relative to the our inner city, a population that we serve. Also looking, as Mr. Sampson said, about the difference between the urban and the rural or suburban settings. I do think we definitely want to see what staff throughout is looking at, not only just our teachers, but everybody that comes across, especially our bus drivers, food service, custodial staff, things like that. I think that'll be a good thing. Gauging where some of our families and students are, mentally, socially, how they're feeling. So I think those things and things that came from the board would be a good start. And then also looking at policy, and then, as Dr. Doan said, knowing that if you make it optional, then looking at when you're in a school setting, is it something different when you go to a certain class, or is it something different when you're in a different, so, because I could imagine that being the hard part, is thinking, okay, it's optional here, but now if I'm in this class, now I got to pull it up. If I'm doing choir, now I have to, so I think if we as the board can kind of see what it would look like, what does this look like, and then also what would it look like to trigger us to change if we did change, what would it look like if we changed back? I do want to lift up what Dr. Goodwine said. One of the things that we all started out this year, the reason we did want the mask mandate was to make sure we stay in school. Knowing that coming back from these, we're coming up on 2 years now. I mean, we left March 2020, and we haven't really had a sense of normalcy since then. So that's one of the things that is on my mind, is making sure we finish out this school year strong, making sure we can stay open. So I think as a board, those are some of the things that would be a good set of data points, a good set of anecdotal data points as well to have that conversation. And I appreciate you both for being here. Are there any other comments, questions from the board? Anything from you, Dr. Lally, on it? Okay, so I definitely appreciate the conversation, and I look forward to looking and reviewing some of those things. I will say that that it has been something I've heard from students. I've been in a couple of buildings in different places, and you do see that it's down, or they might see an adult and try to pull it back up. You know, so just really seeing where we are. I think that really would behoove us to see and gather people, and then understanding what is our plan with everything. So I appreciate, like I said, you all coming out. And while we are on the topic of public health, I do want to shout out Dawn Abbott, who is a nurse over at Wright Brothers, and she won the Ohio School Nurse of the Year. So it's always good to share some of those good things that happen within our district. Thank you all. Now we move to our superintendent's recommendations. Dr. Lally.
Thank you. We have the Human Resources Agenda. It's there for you to review and be able to ask any questions. So I'll let you look at it, and then let me know if you have questions for either Chief Harmon or me to answer.
Thank you. Are there any comments or questions from the board? We'll definitely give some time to review. I'll start over here with Board Member Lacy.
Okay. I guess I was taken aback by the $100 per IEP. I never knew how much we paid people to work on IEPs. Now, I guess I don't know what that means. 'Cause I mean, an IEP is pretty much a life-changing event for a child. And we pay it just costs $100 to put that together?
I'm going to ask Dr. Burton to tell the entire reason why it happens that way and what that is.
I've never seen that before, I guess.
So, Marion. So, right now we are in dire need of IEPs being written because of the number of subs that we have in special ed classrooms. And so we don't have qualified staff to write IEPs. Also, we've had IEPs that have been out of compliance. And so we needed to offer an opportunity for teachers to help us write IEPs, our teachers to help us write IEPs, as well as if we can find other qualified people who can help us write IEPs, because subs can't write them. They don't really know how to write the IEP. And so initially we had it at one price, but we couldn't get teachers that would be interested because they felt the amount of time it would take to write a qualified IEP. So, you know, offering them $100 to write an IEP, we're able to get more individuals in the district that would be willing to help us write IEPs.
Is that about how many hours of work for a quality IEP?
About 2 to 3 hours to write a good quality IEP, because you have to review all the data, and then after you review all the data, then you'll need to write it. You'll need to talk with related services, or it depends upon the child's handicapping condition. So we're thinking about 3 hours to write a good IEP.
I guess what I mean is it just doesn't seem like that much for a really life-changing. I
Now,
mean,
as-
this little report is pretty much it changes that child's future forever.
you would like us
And
to
then
offer
it's
them
just
more?
we spend $100 for all that analysis, or
Yeah.
is this do two people work on one, or
Yeah.
I don't
So
know.
you would like for us to offer them more?
Huh? Well, I guess I would hope that more than $100 worth of work goes into it. That's all. That's what I was wondering.
Yeah,
But
yeah.
if it just takes a couple hours to do an IEP, it takes a couple hours
Well,
to do an IEP.
Oh, sorry. I think it's the type of handicapping condition that the child has. I'm just doing what would it be on average, what I think the IEP would take. But it depends on the child's handicapping condition. Some may take a little longer, some may be a little shorter. So I would say on average.
Okay.
And I would suggest that, and Dr. Burton, correct me if I'm wrong, I would suggest that an initial IEP would be the one that would be the most time-consuming when we're updating IEPs as
Oh,
we're
so
work-
this can be for an update.
It could be
Yes.
for an update as well.
Most of them
Okay.
are.
Right. The IEP might be out of compliance by 6 months. So it's an updating of that IEP so that we're in compliance. I think an initial IEP, I understand what you're saying about that. That is much more than probably 3 hours of work if we do it well. And hopefully the classroom teacher, the special education teacher is the one who's actually writing that. But we do have subs in some of our rooms, so we have to call on some other teachers, some of our other ISSs to do those initial IEPs as well.
That helps a little. I mean, and how often would an IEP be updated?
Once a year.
Okay.
So, yeah, once a
All right,
year.
that helps.
It typically is on the anniversary of the former IEP date. So if today's the anniversary that my IEP was written last year, it has to be done by this date the next year. And otherwise, you become out of compliance.
Okay. Another thing I noticed, total different topic, teachers assigned to administration. I probably have seen that before, but I guess I don't know what that means.
Who
Usually
in-
we have a school. It says administration where there would be a school. You
So,
want an example?
yeah, can you show me who you're talking about?
Line 26, is that what you mean?
Yeah, probably.
Mr. Lacy?
Well, let me get there.
Yeah, I think line 26, 42.
43.
17.
She's a PSC coach.
Okay, line 42 is a home instructor, so their home base is here because they don't really work here. They're going to meet children to give them home instruction. Line 26, I'm not sure
Dr.
what
Lally,
that one is, Chief Harmon.
Yes, ma'am. That line 26 is an example of the PSC coaches that have been hired for next year.
So that person's actively working right now? Or they're going to be working next year?
26.
26. Monica Lamb.
Monica Lamb is a PSC coach that currently works for us right now. But because she's divided in a number of buildings, she's
Okay,
assigned.
that's what I thought.
Yeah,
maybe
then they're
it was.
assigned to the administrative building.
Okay,
That clear that up for you, Mr. Lacy?
that did.
Okay. Who was next on questions? Was it Dr. Goodwin?
Yeah, it's got a couple.
Okay.
On line 47, for this new hire that started in October 2021, that the contract ends in March 19, why is that here if this contract started in October?
Probably because they didn't go through the boarding process, so that you're looking at a cheer coach.
Yes.
So that cheer coach was not boarded, either by some gap in something from athletics or by some gap that occurred to get onto the board agenda. Do you know the specifics of that?
In this case, it's just simply that she's fulfilled her contract, and so it's the authorization to pay her. That's supplemental.
But it's actually her contract that's on here. It says from 10/22/21 to 3/18 or 19/22. So she
Okay.
has not been boarded before.
Okay.
So it's some gap in getting her on the board,
Okay.
whether that's, the paperwork isn't in, but, you know, she can't coach if she doesn't have all of her paperwork in, so we can track that down for you and find
Yeah,
out the answer.
I'd like to know, because if she was working without being paid, that's an issue. If she was working without having her stuff, her paperwork done, that's another issue, so it's,
In this, that's a fair question, but in this case, as a supplemental position, it's a one-time pay at the end of the, she doesn't get paid like regular pays, like a teacher would. A cheer coach, you've done, you know, or any coach really, you've done your coaching season and then it's paid.
okay, but then the other part is the issue, if she was working and we were missing something on our end. I'm not disputing any of the
Sure.
other stuff, it's
Sure,
even if you
yeah,
get paid. at
we'll
the
check
end.
on that, that's a good question.
You got another question, Dr. Goodwin?
I do, but I'll pass it on, I have to go find it now. Go.
Okay. Who else had a question? Board Member Sampson.
Thank you, Mr. President. In line with Board Member Lacy's question, the scholarship that says IEP writing, what role is OEC playing in, I'm still trying to understand why we have teachers writing IEPs and we have an OEC department who does that?
There are too many IEPs for that department to write because of the number of subs that we have and IEPs that are out of compliance. So they need assistance because they have been writing IEPs, but they can't keep up with the demand. So that's why we've asked other teachers to help.
And how many IEPs do you think this group of 1, 2, 3, 4, 5, 6 individuals would be responsible for writing or updating?
That is up to them. They can write as many as they'd like. That's up to them, how many they would like to write.
Do you know what the need is? What is our number as relates that needs to be updated or written?
I can get that number for
Okay.
you.
Thank you so much. Thank you, Mr. President.
But the other thing, if I may, is the academic coordinators in OEC are not the IEP writers for the whole district. They are the coordinators who make sure things are in compliance. They review IEPs and assess IEPs. They help teachers with professional development. A teacher is responsible for his or her IEP, but because we have subs in so many of our positions, that's why we have a backlog. But the OEC department is not responsible for writing the IEPs, just making sure they're in compliance and that they're implemented.
Thank you,
And,
Dr.
and the
Lawler.
other stuff that goes along with, professional development, that sort of thing.
All right, thank you.
With those lines of questioning, Chief Harmon, where are we with different groupings of personnel, transportation, with our classroom, within some of our departments? Where are some of these spaces that I know we just had another hiring event a few days ago? If you could kind of let us know, one, how that event went, and then also, like before, what are some of the numbers? Where are we low at as compared to earlier in the year? Where are we catching up at? Where do we have good numbers at?
Appreciate the opportunity to do that. Really, the only category that kind of stands out right now, and it's just in the last month, we've had, can't tell you the exact number, but we've had a larger number than I expected of paraprofessionals who have left us. And so in that particular category, there are 11 paraprofessional openings, which is the high mark in any kind of category across the district. 11 is the highest number. We have other positions where, there's 0. We have every single position filled. So that's really where our need is. Again, we are always looking for bus drivers, so that number is never going to go away. We just call that a rolling vacancy because it's, if we can hire 5, we'll look for 6. If we can hire 10, we'll try to find 12, So those are the kind of the areas that are our biggest need right now, paraprofessionals. You asked about the job fair the other day, and I have a couple other things along that line I'd love to tell the board about. So, because we're already starting in this time period now, but this is the time that hiring gets kind of hot and heavy for our department. And so starting at the kind of the end of February and then going through April, we are participating or have already participated in a couple, total of 22 job fairs that will be around the state, also local. Those are separate from our locally hosted that we do, our once a month. But for example, on the first, a week ago today, we were at the University of Dayton. We met 33 candidates that day. 31 of those people are already in the process of getting interviews with principals. Out of the 33, or 2 people that we cited, they're not going to get a second round interview with principals, but 31 of those folks are already in the path towards potential hire for next year. We've actually already had a couple that have been hired from that event. There are, if you saw on an agenda, there are about 3 or 4 staff members who have already, they will be hired at next week's meeting for next year, so that's starting to happen as well. Our job fair, our own job fair that was on the 3rd, we saw 30 candidates. As of this morning when we did our HR team review, there were 4 jobs offered to certified staff and 3 classified staff offers out of the 30 people that we met that evening. That was the first one we've done in the evening. We've done all morning events, and so this one was we kind of try to change the day, and also because you might be available on Tuesdays, but you're not available on Thursdays or whatever. Took the same logic, and we've done daytime job fairs. This most recent one we did in the evening, went all the way till 7 o'clock. It did trickle off near the end of that time. So that's another 30 people that we saw. There were 3 teacher candidates that came to those jobs. Those typically don't bring us teacher candidates. We love to have them if they're out there, but those are generally paraprofessionals and bus drivers and that kind of food service workers come to those types of events generally. Of those 3 teacher candidates, 1's already licensed and 2 are soon-to-be grads, and so they're all 3 licensed teachers that will be looking to see if they have a spot. Upcoming, we have Otterbein. That was on the 4th. We had 3 candidates from Otterbein. These were virtual events. Otterbein was virtual with 3 candidates. The University of Illinois, we have 2 follow-ups from that interview day. And Florida A&M is tomorrow, actually. That's a virtual one. And then this Saturday, we have the Dayton Area Job Fair that is from 9 to noon. So I'd love to get, if you know anybody that's interested in and that's any school-related position. That's not just teaching, but anything that's in service to schools, and it's all of the Dayton area schools, not just Dayton Public. But those are the kind of ones that are coming up. And then just kind of a recap of what has happened. We were kind of looking back at what have been the numbers for the year. We've hired for the start of this year. So that those hires could have been before August 1st, but starting August 1st. 267 staff members we brought on this year in our department. So I'm really, really pleased with that, and 37 administrative positions from the start of their time. That's my recap, unless you have questions.
Just a couple follow-ups. I know that with this also being the hiring season, it's also the time when our staff currently here decide if they want to come back here. So I know we have been talking about some things there to kind of get the opinion, get where their thoughts are. Has your office moved forward with any of those ideas we talked about before, like I know you talked about possibly some surveys within, getting some opinions, getting some feedback from our staff about how they are in their jobs and what are some of the things that they would look for, so we can look at how do we retain our staff.
I think we are doing a better job of exit interviews. The surveys are still in the works. Dr. Lai, if you want to add anything to this too as well, certainly I'd jump in. I think I think the communication is better. I think we're doing a better job of really getting to know our candidates and saying, okay, you might really be great for this position at this building with this principal, with this supervisor. Just hearing some of the conversations that are happening in interviews, I think they're getting a lot more specific. There are a lot of lessons that we learned in last year's hiring of how we will be placing candidates in front of principals as well. That's more about setting them up on the right foot from the very get-go, which is a huge part of retention, is having a good start. But we're always looking for ways to expand that too.
Okay, and then, Dr. Lally, I'm sorry.
I was going to respond to the question about the survey. The survey, we're planning on doing that mid to late April, beginning of May.
Okay.
And that's typically when we do the staff survey, student survey, so we'll be doing it. That's kind of the time frame that we're looking at right now.
Okay, and I appreciate that. And then I know you said we had 11 para openings, so by number, that was the highest. Is it different if we look at by percentage of the need that we need to have in our district?
So 11 out of compared to the total number of para positions as an example.
Right.
I haven't looked at it that way, but I kind of have an idea here. That is still probably by percentage. That would be one of the higher ones. Clericals is another. That's probably the next second. Not probably, it is. Paraprofessionals number 1, and right now clericals are 2. We do get results of the testing back from the city, and the most recent test results did not have a large number of passed folks who took the test but then passed the test. So we're a little bit kind of stuck with a fewer number of folks that can pass or have passed the test. So it doesn't give us the number of candidates that we had hoped to see in that category as well.
And the test he's referring to is a civil service test.
Yeah, sorry, thank you.
Okay, and then I had just one more, and I'll pass it over to Mr. Sampson. I was over at doing some reading at Cleveland, and I saw a student teacher who was doing a wonderful job in that class. With that, I wanted to ask, do you know how many student teachers currently we have in our buildings? And then what is the outlook on getting some of those good student teachers that are getting good reviews from their supervisors, their principals, about the possibility of getting them to come in to the district?
Absolutely. So I'll tell you the same thing I tell the student teachers. I don't have the exact number. We have that number, and I definitely can get that for you. We track that in our department. I don't have it handy, but I can have that for you next week for sure. The same thing that Stacy and I talk to teachers, when student teachers, when we bring them in. Understand that this is essentially a free interview, a working interview, and you're getting the opportunity to make an impression with your principal. And we know for a fact that several of those student teachers are going to be brought on to staff. Some of them have already been, are queued up to be hired already. So we hope to bring in, the vast majority of those people.
Thank you, sir.
Thank you.
Board Member Sampson.
Thank you, Mr. President. Please excuse my ignorance because I just don't know. As it relates to the civil service exam, is there a way that we could do like a civil exam prep? Because if the numbers they're not passing, can we internally do a prep? First part. Then the second part, explain to me why we have to use the civil service exam versus doing something else.
We are a civil service district. That's something that was agreed upon a long time ago. All the positions that are union-based positions except DEA, administrative positions and DSS positions are civil service positions, so they must pass the exam. The exam is jointly developed by Dayton Public Schools and Civil Service Board. And for example, if I'm terminated in my position, even though the Board of Education has upheld my termination, I can go to the Civil Service Board and have a hearing with the Civil Service Board, and they can overturn the Board of Education because you are a civil service district. As far as giving classes for that, I don't know that answer. I have to look at the civil service requirements and see what that would be.
Civil service does have their own kind of tutorial as well that some of the candidates do take those kind of pre-test practice tests, but I assume not all do.
Okay.
That's on them, obviously. It's not, you're asking about what can we do, but that is an option for them with the civil service.
Because I'm on a data roll this evening, is there any data that they can show that those who've taken the prep successfully can pass it versus those who don't?
That's a good question, and I'll have to get the answer from the Civil Service Board.
Thank you so much. Thank you, Mr. President.
Board Member Witt Gagne.
Thank you, President Smith. I wondered about the possibility of, as you look at the wages on these positions, whether or not it's our paraprofessionals and even our clericals, of, using the mentality of growing our own. I know we have a lot of career pathways that, are leading into something like this, but of all of our students that aren't going on and going to college, I mean, these are wonderful starting positions, a paraprofessional, somebody that shows, assisting in a classroom, that sort of thing. So I wonder if there's any work we could do as a district to, grow our own in a different way in that capacity. I think we're going to have to get creative. I mean, the Great Resignation is real. There are more opportunities for teachers, all of these folks everywhere. So I think that we're going to have to get creative in our ability to keep these positions filled. And why not use our young scholars, students, graduates who aren't going to college or looking for pathways to other things? So just a thought.
If I may, we can't hire them because they have to pass the civil service exam.
Can we offer the civil service exam as part of a curriculum piece or something like that?
In all honesty, it really is. We've redone the clerical test to be what our clericals would need to do. So we are doing that, but then you have to make sure that those students that are taking the business classes for that pathway, that they know, now if you want to work for Dayton Public Schools, you go take the exam. That's a connector that we could probably be stronger at, but it would be wonderful if we could just grow our own and move them right into positions, but we are tied to the civil service process.
Right, not for paraprofessionals though, right? Just for clericals, yeah. Okay, thank you.
But a paraprofessional can, if they are terminated, they can go to civil service and protest their termination, I believe. Is that correct, Chief Harmon and Dr. Burton?
Oh,
Dr. Goodwine.
I'm already on, nice. Does the paraprofessional position require an associate's degree?
It doesn't necessarily. There is, you can take a test, but if you have an associate's degree, that gets you the same status as having had passed that test.
Yeah, the other thing that I would say is that even if we hire you as a paraprofessional without an associate's degree, because of the work that the AFL-CIO has done in cooperation with all their unions, you and anybody in your family can actually go to school and get an associate's degree.
Yeah.
And so they can, I mean, we hire paraprofessionals who don't have associate's degree who can get one if they so choose.
So is there a test requirement? I mean, that's what the part I'm trying to figure out. How do you, if you apply today to be a paraprofessional, is there some barrier at the entry that we have right now?
No.
Okay, so there's no testing, like, because I heard a test and I just don't know where that came from.
There is a paraprofessional test, I don't know if I'm on or not. There is a paraprofessional test to be an instructional para that you can take, or again, if you have that, a degree, you have that same level of authorization.
But the instructional paras are where? Only?
In a classroom.
Right, but they're only at the Montessori building. The instructional paras are in the Montessori buildings, and they're in special education buildings. We also have paras that are bus paras, and there's no test for a bus para, correct? So,
Okay, so there's just a test for people who want to be in a classroom. Is that, okay, I had a couple other questions, but board member made that come in my mind. I do see, I can't find where it is, but I do see that someone received a DEA bonus, referral bonus. And my question is, how often are we seeing people take advantage of that referral bonus for the teaching staff? And second, while you look that up, because it's somewhere in there, I lost it. Do we have similar bonuses for other positions in the district? I know we have them in transportation, but the other areas where we are actively trying to recruit.
So the example that I can find, there might be more than one on there, is line 68.
Yeah.
The recruitment bonus, which this one was set up, if the person that you recruit, if you are an existing DPS teacher and you recruit a would-be DPS teacher, they get hired, they teach a semester and successfully complete that semester, you as the referring person gets a $500 bonus for bringing us a quality teacher. And the same thing happens again if they complete a second semester, so that referring teacher can, over the course of a year, earn $1,000 per referred new teacher to the district. So it's paid out by semester, so having completed the first semester, and I'm guessing this one was just maybe left off the previous agenda, but the person they referred did complete the semester, and so they get their first half payment.
Can you look over the last 2 years to see how many teachers have actually been able to take advantage of this or refer someone, if any?
I can tell you that this particular referral idea was something that we brought to the table just this past year. So this is the
Okay.
first year. There's been other things. Dr. Lally had a hard to staff referral, or hard to staff bonus, not a referral, hard to staff payment, which we're going to continue with as well. But this particular one is just new this year.
Okay, and are there things in the other professional departments that we have that we offer for referral bonuses or higher bonuses? And
we offered, I believe it was a year ago, we offered bonuses for any bus driver who brought bus drivers in. We offered a bonus to them for bringing their friends to the training, and when their friends were hired, they got the bonus paid out. I think it was like $100 and $75 or something like that. But I think that was a year ago that we offered that bonus. to people. We also offered an attendance bonus to bus drivers when we were in the COVID situation as well. It was so many, and Treasurer, if you can remember and help me out a little bit, so many weeks of good attendance, and they got like an extra $100 after maybe 2 weeks of good attendance, or maybe 4 weeks of good attendance, something like that. We can look that up, but we did those kind of incentives as well.
Okay, so it may just be something we want to look at for our paraprofessionals, if I'm hearing that that is a need area, and I didn't hear that we had anything currently for that group, or bonus, or just people in general who get people to come work at DPS and they stay whatever time you guys say. It may just be a overall bonus or something that you can think about.
I want to say that I appreciate Dr. Lally giving our department the opportunity to come up with those kind of innovative things. So the referral bonus that you asked about, the original one, this first $500 payment, that came because we brought it to her and she said, yes, we think that's a great idea, but you have to build it into your budget. So we did. So any other recruitment ideas like what you're suggesting, maybe with paras, we'd have to find a way to build that into our budget to allow for that. So.
Okay, and I think I've seen about 5 individuals leave us in transportation on this time around, but I do see substitute drivers coming in. And
Substitute drivers means that those are trainees?
Yeah,
So
that's what
you're
I
a sub
figured.
until you're a trainee, yes.
yeah, that's what I figured they were. But I guess my question is, were you able to do exit interviews on any of the bus drivers that left?
The answer on that one is no.
Any particular reason, like did they decline to do them, or did we not try?
No, their resignation, they turned their resignation in electronically, and I never saw them.
Any other questions from the board on human resources?
I have an answer for Mr. Sampson. You asked me about how many IEPs. There are 184 as a result of the number of vacancies we have for special ed teachers. We have 184 IEPs that need to be written as a result of that, for the most part, because of the vacancies in special ed.
Thank you so much.
Once again, once around. If there are no other questions or comments on human resources, Dr. Lally, your next recommendation, please.
Actually, we have human resources after July 10th. There are 3 people on there who have resigned effective either in February or in January, and that is against the Ohio Revised Code, so that's why they're on the after July 10th agenda.
Okay, are there any questions or comments on DA after July 10th? If there are none, your next recommendation, Dr. Lally.
Next recommendation are contracts and agreements. And the contracts on here are, there's the Antioch Shrine is being rented for 2 of our proms, Thurgood Marshall and Dunbar High School on different days. And then the Daybreak Runaway Shelter, it's an increase for our Title I Part D programming. This is one of those where we pay out to an organization from that Title I grant, and it's for disadvantaged children targeted assistance grant that we monitor and pay that out to the Daybreak Runaway Shelter. A picture booth rental for prom, and then also the University of Dayton Arena. This is for our graduation ceremony, since Welcome Stadium will not be finished for graduation this year. So we have rented out the University of Dayton, and we actually, it was originally $32,000, and they wanted to store gym floor under Welcome Stadium. So for that storage for the month of March, they agreed to pay $10,000. So all we did was deduct the $10,000 from this contract. So the contract is now $22,000.
Are there any questions or comments on contracts? Stevie, Board Member Sampson.
Thank you, Mr. President. I just have a question as relates to, is it possible to put what prom or, yeah, what prom for April 23rd, what school is going for, is just missing that part. That's all. Thank you, Mr. President.
You say for the
Picture,
picture booth?
yeah, just listing the school. It's
Yeah, we
not
we
listed.
believe it's Ponence, but I'll double check that for you.
All right.
It's Ponence.
Yeah.
Thank you.
Any other questions? Dr. Goodwine?
Is Ponus the only prom that's gonna have a picture photo booth at it?
It's a choice that the juniors and seniors, whoever's running the prom, they make that choice, and then they pay it out of their student activity funds. They're the only one that we know that have rented it, and they've rented it a couple years in a row. I have not seen it on anybody else's prom for that. So it's all based upon the building's funding and the student activity fund.
Any other questions? If there are no further questions, Dr. Lally, your next recommendation.
The last recommendation for a vote next week is the resolution for the Dayton Community Foundation. We have some funds that have been donated and are in accounts at the foundation, and we need to have the board approve that we accept those, and then we can bill those out and spend that money in there. Account number 2742 is from the Mateel Foundation. That has about $153,000 in it that we have used or will use to pay the City Connects partnership that we have at Bellhaven. And if you recall, City Connects is similar to our neighborhood school centers, but it's through Boston University. So there's the Mateel money pays for part of it, and the district pays for part of it as well. And then number 3730 is a smaller amount. I believe it's under $10,000. It's for career development and mentoring. And once the board approves that, then we will let our career technical director know that that money's there for that program to have a little bit of money to spend on what they choose to spend it on. There are no stipulations for the career development mentoring program.
Are there any questions on that? I will start with Board Member Lacy and then go to Board Member Sampson.
I guess I don't understand what this is at all. Those numbers, those are not our funds.
No,
This
those are
is-
code numbers from the Dayton Community Foundation. They have accounts that have been set up by various donors at their foundation that have been earmarked for the Dayton Public Schools. So that's their account number, if you will, for the funding that they have there. The Mateel funding was in account number 2742. And we won't see that money. It's like a pass-through, so we will bill them, and then they'll pay out the money for that. Or if the treasurer will bill them, then they'll send a check to the treasurer to pay for the Mateel, for the City Connects process that we've been working in.
What do
So-
you mean when you say we won't see them?
Well, we don't draw it out of there. I shouldn't say we won't see them. We have to bill them, and they'll send the check to her for City Connects, for the cost of City Connects. It's like a pass-through kind of. They don't write the check to City Connects, we do.
Can we see what's at the foundation that's earmarked for Dayton?
Yeah, we have a whole list of them. And several months ago, I think in 2019, the board approved several of the funds that were still sitting in the Dayton Community Foundation. And these were two that had not been approved for us to actually bill the foundation for the money. Yeah, we have a list.
Okay, if I
Yeah.
could see that.
Madam Treasurer, were you about to add something in with that?
No, we have statements for Dayton Foundation. We have those trusts about $600,000. And we show it in our CAFR. When we do the CAFR, we show it as outside entity. So the board should approve it to be used.
Okay.
So if you need the statements, I can bring it to the finance committee, and we can
Alright.
discuss it.
But it's just in the CAFR, it's like in the notes of the CAFR, or?
It is in the cover,
Okay.
yeah.
And Mr. President, if I may, there's just a list that we get. For example, there's a list that says for STEM, for math and science, and then it just gives us the amount. And then there are 3 accounts that are controlled by the foundation by the donor's request. But we turn names in. For example, there's a Dunbar Scholarship. So we turn the name in to the foundation, and they issue the check to the student, but we are the ones responsible for telling them who to pay.
Okay.
So it's that list of funds that we have.
All right, I appreciate it.
Did that answer that, Mr. Lacy?
Yeah.
Appreciate it. Board Member Sampson.
Thank you, Mr. President. I just want to say, Dr. Lally, I appreciate the explanation of the 2 funds, because the way I read it, I thought 2742 was being transferred to 3730 because of the word two. So I don't know if it should say and. I just thought it was a transfer, so I appreciate that explanation.
It should say and.
Are there any further questions? If not, Dr. Lally, does that conclude your recommendations?
It concludes my recommendation. Thank you.
Thank you. We're on to Madam Treasurer. Your recommendations, please.
Okay. I have a resolution accepting the amounts and the rates as determined by the Budget Commission and authorizing the necessary tax levies and certifying them to the county auditor. So the board has to review the rates and certify them. So what we have is, if you go to page 3 on these rates, as you can see, in 1976, we had 32.50 mill levies, which is estimated by the Budget Commission 27.1 million. And another levy passed in May 3rd, 1988. It was 15.27 mill levy. What they are estimating at this time is 16.6 million. And another one, November 3rd, 1992, there was a levy for 10.4 mil. The estimated revenue for that one is 12.6 million. Another one is, the latest one is November 4, 2008, 4.9 million. The estimated revenue is 6.8 million. This is general fund operating account. And the next one is for special levies. In November 5, 2002, there was a levy and 0.5 mil levy, which is estimated 700,830. For classroom facilities, that is in November 5, 2002, that is half a mil. It will bring, the estimated revenue is going to be 700,830. The bond levy is November, the same time, November 5, 2002, 11.5. That will bring 18.8 million. This is estimated as determined by the Budget Commission.
I'll start with Board Member Lacy.
Okay, you say, you're reading from page 3, or is that 4? 4.
Page 4.
And the top says maximum rate authorized to be levied, but that's not necessarily true for bond. levy, is it? I mean, can't that go up and down?
It goes up and down as is needed.
Right.
If they bring the revenue for that payment, if it is less, I have to go to the county auditor
Right.
and ask to increase that levy. Or if we collect enough money, I don't have to go. So
And-
it goes up and down.
And in this case, this is the same as last year, or?
This one is the same as last year, but
Okay.
I remember twice during my tenure. we
So
had to
somebody can't
adjust
say,
it.
we're raising taxes.
No, we're not. We have to collect enough money to pay the,
Right, and
Debt.
is that enough? 18?
For right now-
18.8 for now?
yes, for right now, yes.
Right.
But when I see,
Sometimes if it gets too low, then we have to vote to raise taxes. So, yeah, basically.
no, we don't have to vote.
Oh, this is not a vote?
It is voted for
Yeah.
the maximum, we can collect for the maximum amount
Okay,
of that debt to pay.
I see what you're saying.
So if we collect enough, we don't have to increase it. If we collect less, like I remember in 2016, it was less. So we
Right.
had to go to the county auditor to increase it,
Oh, I see,
to pay the debt.
okay. And then, I mean, I don't know if I voted on this before, but since I work for the treasurer's office, Mr. President, and I collect these taxes, I guess I probably, just out of caution, I'll just not vote on this, if you don't mind.
It's a required.
No problem, sir.
Okay.
Mr. Sampson, do you have a question?
No, sir. Thanks for
Okay.
asking.
Okay, I thought you had your hand up.
No, sir.
Okay, are there any other questions for Madam Treasurer on this item? If not, your next recommendation, please, Madam Treasurer.
The next one is monthly financials for February. This is a placeholder until the Finance Committee meets on Thursday.
Okay,
We'll go to donations. We have several donations, which is so good. Okay. Arlie B. for McKinney-Vento, $100. Ken Hayes for Male of Color, $1,100. Shiloh Baptist Church for distinguished females and males of color, $1,000. Shiloh Baptist Church Mission Ministry, FBO, for males of color, $500. Thank you, donors. We appreciate it.
yeah, definitely, I want to also say a thank you to everyone that donates and encourage people to utilize those donations. I encourage those entities that get those donations, not only as the board, but those recipients. I encourage them to also be thankful of those things as they come in, and I appreciate the community for being a part of this educational system. Are there any other questions or comments on donations? If not, Madam Treasurer, your next recommendation, please.
Next one is the minutes for February 8, February 15, and February 26.
Okay, any questions? Madam Treasurer, your next recommendation, please.
Purchase requisitions. All these purchase requisitions are from different departments. Let's look at, and if you have any question, we'll answer them.
Okay, I'll give you guys a brief time to look over, see if you have any questions. I see Board Member Lacy has a question, and then I'll go over to Dr. Goodwine.
Okay, CDW, the first one we'll go with. Is this, okay, it's 1,000 laser printers removal and toners removal and installation. Is this for removal and installation, or is this for actual assets?
It's actually a replacement of the classroom printers that are in our 1,000 classrooms right now. So every teacher by the fall will get a brand-new printer. Those printers will be recycled.
So we have one in every classroom.
Yes,
Okay, and we're replacing them
yes,
for $500 a piece. And we have 1,000 classrooms?
yes.
How many schools do we have?
We have 15 elementaries, 1 preschool, 7 middle schools, but 2 are within high schools, and 7 high schools.
So how many buildings? And I just
28.
Okay. So that's.
But they all aren't, we have 28 counting the service building and us.
So 1,000 divided by 28. We have 35 classrooms per building.
We have more classrooms in our high schools,
Right.
and then a smaller number in our elementaries. But you gotta remember, we also have special education
Right. We have
rooms.
about, I mean, like most of our schools are like 12 or 13 classrooms, probably.
No, in
Maybe
most of our
2 or
schools,
3.
we have anywhere from,
Okay, maybe 18.
yeah, we have anywhere from 2 to 4
Okay.
of each grade level. And I can, if you want the breakdown, I'll get that for you.
All
But there are
right.
about 1,000 classrooms.
Any other questions? That's Board Member Sampson, right? No, Dr. Goodwin was
Yes.
next.
So on these purchases, what is our diversity spend on these purchases, on both the over 25,000 and under? And what are we doing to push to try to spend money with minority and women or women-owned businesses that are in some of these areas?
In a lot of the things that we spend, like in technology and some of those other things, they come off of a consortium list. So I can't answer what the minority breakdown of those are because we just use that consortium list that's approved and purchase that. Treasurer, I don't know if you want to answer that question or not.
So let me back up to the consortium list.
Yeah.
Because how do companies get on there? Because if that's a barrier to us getting, because these fields, there are companies in these fields. I do know that. I just searched half the stuff we have on here. But if that list is where our purchasing officers are pulling from, what needs to happen on our part to get more diverse spend with our dollars on that list?
The consortium list, I think, is generated, it's the government's consortium list. Chief Hurwitz, can you address that a little bit, since it's, procurement is out of your department?
From a procurement standpoint, I can tell you what we've been doing, and I know that Mrs. Allen specifically spoke with you. We're including in our bid documents to make sure that we are following a percentage of diversity and including inclusion. From a perspective, I believe it's the Ohio DAS, the procurement website. Anyone is able to go and sign up. There's instructions on how to do it. From a standpoint from our department, from purchasing, I can get you more information and explain essentially how are we providing that to vendors that we work with.
Okay, yeah, I want to see how not only are we at the threshold here, but how we are actively seeking to, this is a diverse urban district. We should be actively seeking to do business with diverse companies because that's just the makeup of not only our board, but the students that we serve and the individuals in this district. And when you say DAS, are you talking about Department of Administrative Services?
I can't answer that.
So you just threw some acronyms out there?
I'm throwing it
Okay.
because I remember it, but I don't remember what it stands for,
Okay.
if I'm to be honest with you.
Mr. Sampson.
Thank you, Mr. President. If somebody could share with me the Key Behavior Services LLC, who is that? And what is the behavior technician support that's serviced by OEC? What does that entail?
Mr. Sampson, I don't have all the specifics of exactly what they're doing, but based on the students' IEPs, there was a need for some additional services for which we did not have the capacity to provide, and so we needed to contract that work out. I can give you the specifics of exactly what that is. I'll send that to the superintendent who can provide it to you.
And are those needs only at Ruskin, or is it, are they only servicing Ruskin, or is it the district?
I'll get that answered as well.
All right, thank you so much.
Any other questions? Give a few more moments, see if we've gone through the list. Ms. Spencer Reiner.
Thank you, Mr. President. I have a question about the less than 25K. Just curious, the Belmont High School, for Perfection Group, Belmont High School Boiler Reset Services to correct a boiler design flaw. What do we know about the boiler design flaw? Is it in any of our other buildings? Just want to make sure that we're not, I just would like a little bit more information about that, please.
Chief Hurwitz?
Sure. The original design incorporated a bypass valve for the hot water. Essentially, during the investigation of the system, it was actually improperly installed. And so this is for this to be reversed, and it has since been disabled.
Okay, thank you, I appreciate it.
Board Member Sampson, then back to Dr. Goodwin.
Thank you, Mr. President. Under the same less than 25,000, safety through engineering, what is the drawings and engineering for the new boardroom sitting area? What is that?
So we went out and got some drawings to redesign this boardroom to bring both sides out so everyone can see each other. So essentially the corners will come out so that everyone can see each other. And that is specifically to the drawings.
Thank you so much.
Dr. Goodwin.
That was the question I was gonna ask. I'm good.
Canceled each other out, I see. Any other questions?
Okay.
If there
if you-
are none, I will go back to Madam Treasurer. And as always, please do know if you have any questions during the week, leading up till next week, feel free to reach out and ask them as well then.
Oh, there is one Zenin now.
Yes, ma'am.
Okay. We have two Zenin nows. One is for AT&T Mobility, $450,717.24, and Calico Partnership for $855,000. Those are for the hotspots and connectivity, student connectivities.
Okay, and those did not come out of general funding, Madam Treasurer, did they?
These are that connectivity grant 599.
Okay, and are there any other questions from the board for the then and that?
I have a
Ms.
related
Spencer-Reiner.
question, Mr. President. Superintendent, if I may, this reminds me, so we did get the connectivity grant, and thankfully we didn't have to go remote, and we're not looking at that right now. Do we have the laptops and the Chromebooks yet? No?
No, it was a 4 to 5 week wait on that, so we're just waiting for those to come in. We do have the students that will receive those.
Okay.
They've been identified, and we sent out a second survey to pick up any additional students that we might need to pick up at this point in the year. So as soon as they're ready, there's a process in place. I think I sent it out to the board in the board update. There's a process in place, and there are bags that they'll go into. The hotspots, if they don't already have a hotspot, if you recall, we had 1,800 that we gave out that we did not, that don't fit in our fleet. They had been donated to us, and we gave those out earlier with hotspots. So those students that didn't get one of those and a hotspot have gotten hotspots or will get hotspots with a Chromebook that comes in.
Okay, I did fill out a survey. I got a
Okay.
survey and I had to fill it out. Do we know when we'll get those?
I
Is
can
it
check
still
with
supply chain?
Mr. Taylor. We should be close to them arriving at this point, so he may have some updated information. I'll check with him and see what the target date is.
Okay, thank you, Superintendent. Thank you, Mr. President.
Board Member Lacy.
So we're going to pass out these Chromebooks as soon as we get them,
Yes, yes.
and then,
That's part of the requirement of the Emergency Connectivity
Okay.
Fund money,
all right.
yeah.
Dr. Goodwin.
For families that may have missed that survey, how can they connect with you to submit that type of information to you?
They just need to let us know. They can either call the parent line typically and just ask for the superintendent's office. The survey's probably still out there as well online, and then there are principals that also know which students need to have some technology, so they can also tell their principal.
Okay. Is it possible to get that in a quick little flyer to share on our pages for people, the parent line number to contact you guys if they have more information about this connectivity?
And we can tell them where to go to fill out the
Yes.
survey. Yeah.
If we can just get a nice little boom.
Can we do that also then for Parent Square and our other means of communication to our families that we use, send out some of those through the schools? Are there any other questions for the then and now? If not, Madam Treasurer, does that conclude your recommendation?
Yes.
Why, thank you. Up next on our agenda is a board recommendation, which is a resolution to approve the treasurer's contract, and that is for a vote. So I will say I'll recommend approval of the following resolution to approve the treasurer's contract.
So moved.
Second.
It was moved by Board Member Sampson, seconded by Dr. Goodwin. Do we have any questions on the motion? Any other comments on the motion? If not, Treasurer, may we have a vote?
President Smith,
Yes.
Ms. Reinhardt,
Yes.
Mr. Sampson,
Yes.
Ms. Wiegany,
Yes.
Dr. Goodwin,
Yes.
Mr. Lacy.
Yes.
6 yeses.
That passes, and I want to say, on behalf of the board, we are happy to continue working with you, Madam Treasurer, and we appreciate the strengths that you bring to our district and how you come across in not only giving us the information that we need, but handling our financial duties. So we look forward to that, and we look forward to those clean audits. Put the pressure on you.
Okay. Thank you very much.
Now, maybe have to refresh. You say what? No, I do not. You thought I was freestyling.
I was president for a year.
No, ma'am.
Didn't know that. You know, our district champs.
5:30 at Trent Arena. Online tickets. If you want to get it, go online.
And if I may real quickly, Mr. President, before we dismiss, to let people know, I believe next week we are across the street in the old boardroom. Is that correct?
It is correct. We shall have a bunch of visitors with us, which I'm excited to see. So we will be across the street in our previous boardroom for next week. So pursuant to section 121.22G2 of the Ohio Revised Code, I move that this board go into executive session. This meeting is being held to consider the employment of public employees, including compensation or other terms and conditions of their employment, and to consider the employment or dismissal of employees. Is there a second?
Second.
Seconded by Mr. Sampson. May we have a roll call, please, Madam Treasurer?
President Smith,
Yes.
Ms. Reinhardt,
Yes.
Mr. Sampson,
Yes.
Ms. Wiegany,
Yes.
Dr. Goodwin,
Yes.
Mr. Lacy.
Yes.
6 yeses.
We shall now recess to upstairs on